side flexors, that is the lateral flexors of the trunk. In all the pace ball study, the injury occurred on the non-bowling side, arm side, as a result of the bowler non-bowling arm being pulled down from the position of maximum elevation with some lateral flexion during the final delivery action. So this is a very common injury that happens to be in the pace bowlers. The tip of the lower rib can enlarge and rub against the pelvis during the delivery stride, or the soft tissue can impinge between the two body structures. This impingement leads to injury. Sometimes the bone and the cartilage tip of the lower rib can even break off. And occasionally, this injury are true side strains in which the muscle between the ribs are tear. Treatment involved modifying the bowling technique, taping, and rehabilitation program aimed at pain relief, recovery of mobility, and strength. Back injuries, this is very, very common in fast bowlers. A very serious lumbar spine injuries are seen in as a lesion in the pars interarticularis. Compared with the 6 to 7% prevalence of lumbar spondylitis in male general population, pars lesion are identified by cross-sectional radiographic examination in 20 to 55% of retired and adolescent bowlers respectively. And this is the most common area that gets affected, most common area that gets injured in fast bowler. This pars lesion often occurs in L4, L5 level of the lumbar spine. L4 pars lesion is fast bowler develops as symptomatic unilateral lesion in the non-bowling side. That is, in the right bowlers, the stress occurs on the left L4 L4 lumbar spine pars lesion. Presumably, the asymmetric loading of the lumbar spine associated with specific motion, that is such as lateral flexion or axial rotation of the trunk during fast bowling, that predisposed to L4 lesion in the non-bowling side of the bowler's arm. So this is very, very important information. Let's come to the lower limb injuries. For the knee joint, the lower limb injuries like meniscus injury it's very rare, happens with the cricketers. Cruciate ligament, ACL and PCL injuries are not common in cricketers. It may happen sometimes, but it's the occurrence and the chances are very rare. And in collateral ligaments are also rare. So the most common injury that happens to be in cricketer is patellar tendinopathy. And patellar tendinopathy is mostly an overuse injury, which is shown to occur in up to 20% of athletic population. Patellar tendinopathy is seen as an overuse injury and occurs in cricket, especially in the bowlers. Overload of the tendon, either as a one-off event or over a period of time, can lead to breakage of fibers or tendon at a microscopic level. Although damage can occur anywhere in the tendon, it is most often found in the posterior deep portion of the proximal patellar tendon near the tip of the patella. Hamstring injury. In cricket, fast bowler involves many sudden explosive movements and rapid change of direction that results in hamstring strain. Basically, hamstring injury occurs while overstriding or lack of eccentric strength in the hamstring muscle. Foot and ankle injuries. Studies say that around 11% of injury affects in fast bowler involving foot and ankle. No distinction has been made between the foot and hind foot or forefoot. Biomechanical studies have shown that the forefoot are more prone to acute injuries during high peak sagittal movement during bowling, whereas hind foot is more susceptible to overuse injuries. Fast bowler who plantar flex their foot in their delivery stride have posterior impingement, which presents for many years, can eventually result in formation of bony spurs. If the bony spurs develop, usually the player has to go for a small surgery to remove the bony spur. Now, how we can manage the injuries is through the proper strength and conditioning program. And there are certain strength and conditioning points which one has to remember while training the athletes. The importance of intermediate training. The intermediate training has been highlighted as significant tool in preventing cricket injuries in cricket players. It is not for only development of anaerobic capacity, but also because of the eccentric loading in the lower limb musculature. The eccentric strength I'm repeatedly saying eccentric loading, eccentric strength is very, very important, especially in a sport where overuse injuries are common. Cricket is the kind of sports where most of the injuries are overuse or repeated loading injuries. In such cases, eccentric loading is very, very important. It has been shown that traditional in-season training program combined with the demand of match play are not sufficient to maintain player fitness throughout the competition period. Thus, the player should be exposed to more high-intensity, low-volume sessions. Repeated sprinting ability protocols such as 20-meter shuttle, 30 is to 15 interval fitness, intermittent are probably the important training tools for all cricketers. In addition, this type of training may improve the ability of the lower limb musculature to handle high eccentric load. Cricketers are exposed to compulsory eccentric muscle demand as a result of need of repeated high intensity effort during numerous deacceleration acceleration phase. This has been shown to contribute to muscle strain injuries, particularly quadriceps and hamstring. So if the players are not conditioned properly, are not being exposed to eccentric muscle strengthening or eccentric load, the chances of muscle injuries, that overuse injuries, especially to the hamstring and quadriceps, are very, very common. Core muscle strength and flexibility have been highlighted as an important factor to consider for injury prevention for the cricket players. So core muscle is very, very important, as core muscle is the connecting link between your lower body and your upper body. So when the bowler is delivering a ball, the entire strength of the lower body is transferred to the upper body via the core. So if the core is not strong enough, it will not be able to use the strength and the power generated by the lower extremity to deliver the ball at a speed of 140, 120 kilometers per hour. So core strength is very, very important. And this is particularly for the fast bowlers who are more prone to low back injuries. Stabilization of the core musculature can improve the lateral side of the fascia in the anterior abdomen, and as a result, decreases the risk of injuries in the fast bowler. Anterior abdominal slides occur during the concentric contraction of the transverse abdominis muscle bilaterally during normal cricket delivery. In addition, training core muscle is essentially important in young cricketers where abnormalities of spine, especially with a mixed bowling technique, can predispose to these players to stress fracture later in the career. So core training is very, very important and shown to improve trunk mobility, stability, rotational strength, and flexibility of the cricket players. Lumbopelvic hip complex injury is very, very important, can reduce and control the injury in three ways. Number one, stabilization of the core muscles and joint ligament to ensure intrapelvic stability, improve lumbopelvic stability, and finally, strengthening the hip abductors and external rotators to help the pelvic femoral stability. Therefore, strength and conditioning coach must consider addressing trunk position as well as dynamic control of the trunk and pelvis. So this is a basic an example of the kind of workout that can one incorporate in conditioning sessions of the athlete in order to prevent injuries, that incorporates all the required amount of demand for strength, for plyometrics, for core is mentioned here. This is one example where the exercises are mentioned. This is another one. Examples of 6 weeks of conditioning program before the start of the session or the season.